This is Brennan Marilla. I'm the Chief Commercial and Operating Officer for OSSIO, and I am here with Dr. Jarrett Cain. Dr. Cain is Associate Professor of Podiatry at Penn State Health and the College of Medicine. He has a busy and successful academic practice, and we are excited to have him on today. So Dr. Cain, welcome and thank you.
Thank you.
I want to just start off by asking you, what's going on in your community with COVID-19? How is this affecting you, and how is this enabling you to manage your practice?
Well, we're taking every precaution to, number one, protect the patient by not putting them at any additional risk. But with that being said, we are making ourselves available for emergencies and any other pathology that needs to be seen on an emergent basis. So what we're reinventing ourselves and making telemedicine a greater avenue for patients to access us when need be, and as well as making ourselves available on the hospital side for patient care as well.
How are you, any tips on how to do an appropriate patient consult over using telemedicine or some remote video? How are you doing it, and what are kind of the, I would say, tips and tricks?
Well, each hospital system probably has their own way of setting it up, going through their particular whatever teleconference modality that they'll use. So with that being said, once you're able to kind of get things set up, then the learning curve for it to be used is not hard at all. And it's just a virtual way to examine and treat the patient. Even though it's virtual, I still tend to use some X-rays. I can go over X-rays, and I take a foot model that I use to further enhance the examination experience to make sure that I can carefully correlate what I'm trying to convey to the patient, because I don't have them in that typical clinical setting, but nevertheless we still are able to kind of convey the condition that they have and the treatment options that will be available to them. And then just kind of making it, putting them at ease and making sure that they have a greater understanding of what the condition they have and what treatment options are available moving forward.
Yeah, are there certain video modalities that you prefer over others? Do you use Zoom, or do they just use their iPhone? Or
so each hospital system will probably vary. I'm sure some are using Zoom, but I've heard Amwell is another one that is available, and so it really depends on the healthcare system.
Has this situation changed how you'll manage your practice moving forward?
From the medicine point of view, I think this will reinvent and make us reevaluate how we deliver healthcare medicine in the future. I think that's what, if anything, this virus has taught us to, become more sophisticated in our delivery of care to the patients, and making sure that we're available, through various avenues to make sure that we can still put the patient's needs and that their needs are being met in spite of this pandemic that's going on.
What advice or I guess lessons that you would want to share with your peers in terms of dealing with this and managing their practice, whether it be academic or private? What are your key insights that you would want to share?
I think the biggest thing is, in spite of the changes that are taking place, it still doesn't. The delivery and the delivery methods may change, but still ability to diagnose and treat the particular condition. Affability, making sure that we carry ourselves in a particular way that the patient's clinician experience maintains is a wonderful experience from the patient standpoint, and also availability. So the 3 A's while the coronavirus is making us reinvent ourselves, the 3 A's don't change. And that's ability, availability, and affability, and making sure that we use those in a sophisticated manner with the telemedicine avenues that we have.
Yeah, great, thank you. I have one final question.
Sure.
What have you learned about yourself during this stay-at-home period so far?
Well, I think the biggest thing is being able to adapt. That's the biggest thing. We are creatures of habit. So the quicker you are able to adapt, the better you are at staying ahead of the curve with changes that need to be made, whether it's from a building or coding standpoint, whether again, we've talked at length about telemedicine, whether again, educating myself on different webinars and different, and communicating with colleagues through email and phone conversations, making sure that all of those avenues stay open. It is easy to get pessimistic and to kind of think that there's no light at the end of the tunnel, but this will pass, and we need to maintain hopeful. We need to convey that hopefulness to our medical colleagues as well as to our patients, and just make sure that once things do start going back to the new normal, that we have every treatment option that is available to serve our patients to the best of our ability.
Yeah. Great, some great advice there, Dr. Cain, and some great messages. I thank you for your time.
Thank you.